Hey there, I'm Dr. Norris, owner at Chiropractic here in Louisville, Colorado. And today I want to give you 5 exercises for low back pain, specifically acute low back pain potentially caused by irritation to your lumbar discs. All you're going to need for these 5 exercises is yourself, a firm floor, and a yoga block or something similar to it. So anytime you have acute low back pain, you definitely want to be getting checked out by a provider, whether it's a chiropractor like me, a physical therapist, or your general practitioner. Eventually, you may even need to go see a neurosurgeon, but let's try to prevent that. That's what these exercises are all about, okay? So this is really relevant to me right now because as a chiropractor, believe it or not, we experience back pain sometimes too, right? We're bending over, we're working with our bodies all day. And whether you're like a manual laborer or you sit at a desk all day, you're putting a ton of stress and strain down through the spine, all the way really from the neck to the lumbar spine. But typically the lumbar spine is where we're doing the most damage. And that's simply because we're stuck in this flex position. And what that's doing is it's allowing the disc from going wedged forward to backwards, and then that disc is going to bulge, touch a nerve. Eventually, if it tears, it's also going to create an inflammatory response that's going to cause a lot of problems for you. So these exercises are adapted from the McKenzie Exercise Protocol. Dr. McKenzie did research to find that extension exercises, right, getting the wedge disc going from backwards to forwards again, is really what's going to help you get out of that acute pain as quickly as possible. So let me show you those 5 exercises I think are going to help you the most. If you experience an increase in pain or increased numbness and tingling into the legs, you need to stop the exercise immediately. You should experience probably some discomfort, but severe pain that just doesn't go away after doing the exercise is a big concern, and absolutely you need to go see a specialist when that happens. So for a lot of us who are experiencing acute low back pain, we're kind of stuck in that bent over position where bending forward hurts, but so does standing up completely. So the first exercise is simply this. You just lie on your belly. You're gonna put your head down and then turn your head to the side for about 30 seconds each. Do that a couple times a day. So the next one, we're gonna get into a extension where we actually want to prop ourselves up onto our elbows and really get a good contraction of your glute muscles, okay? This is more of an active stretch or activation than anything. And so don't sit there with like a really relaxed butt. I want you to squeeze it into the floor as hard as you can, and then just let your elbows support you. You don't need to start pushing backwards yet. And again, if this causes pain, rest for a minute, but if the pain goes away, you can still proceed. So the third exercise, we're gonna go from this position where we're in prone extension with our elbows supporting us. Also in yoga, we call this cobra pose, to more of an upward dog, okay? And so in this position, I'm actually gonna push my hands up, squeeze my glutes as hard as I can, and really get into extension. I even kind of push my chin back slightly, again, keeping the glutes nice and contracted. You can even put your feet flat on the floor so your hips can really stretch out there, or you can just rest on the thighs and knees. But you should feel a nice deep stretch in the front of the hips, right in the kind of hip flexor psoas insertion point here, and a good, contraction in the low back. This is not really meant to be comfortable, it's just meant to get you out of pain. So don't worry if it doesn't feel that good, as long as it's not causing severe increases in pain. Okay, so the fourth exercise is gonna be standing extension. And what you wanna do is put your hands right on your glutes just to give yourself a little support. Really get a nice contraction here. It's just gonna feel like you were doing it on the floor before, where these are contracted, you're getting a little stretch in your psoas muscle, and then really lift the head up and start to tilt backwards and push the glutes forward with your hands. And then hold that position. Make sure you're breathing. And then safely come out of it. Never do that and let your glutes relax. That's how you're gonna really pinch and irritate things. So again, a lot of glute contraction, that's your support muscle right there. And then lean back. All right, so here's where you're gonna wanna use the yoga block. A yoga block has 3 different heights to it, right? You got small, medium, and tall, all right? For this one, we're gonna use the short height first. You're gonna lift your hips off the ground, and you're gonna put that yoga block right under the base of your spine, your sacrum, where you feel those 2 little dimples. And a lot of times people who are misaligned or subluxated actually get pain right there. And that brings up another point. If you're not getting adjusted, these might not work that well. So if you're doing exercises and you're not getting a great result, I really encourage you to go find a great chiropractor who can help you with these issues, because the combination of the exercises and the adjustments is what gets me and my patients such great results. So going back to the exercise, what you want to do is put this right under the base of your spine, then slowly lower the legs and knees to the point where you're just in this extension position. Now, after doing the exercises I just did, this is fairly easy. At other times, if I haven't done those exercises, this is kind of hard. So it just depends on where you're at during the day and how much pain you're in. If this feels easy, what I'd recommend is either switching to the medium position, and again, getting that right aligned at the base of the spine. You really don't want to get up into the spine at all, okay? If you do this, it's not really supporting you the way I want it to be. You want to get it down, almost like on your tailbone, right on the belt line and below. Don't go above the belt line, okay? Same thing, I'm gonna lie in extension here. This feels nice. It's kind of letting everything essentially relax. If you're in spasms, this can feel a little scary at first, like, oh my God, what's gonna happen? But what you'll notice is the longer you stay here, the muscles just start melting away. They realize they don't need to protectively hold everything in place. That's what the spasms are there for. They're trying to stop it from getting worse. This is a helpful position, so that's why it will relax. And then finally, if you're feeling really good, what you can do is put this up into the tall position. You can start in a supported bridge pose here, right? So my legs are bent, my full weight is resting on this, and I'm just relaxed in the shoulders and upper body. And again, if you're feeling really advanced, you can put your legs straight and let it all relax. And this for me right now is like the perfect spot. I can feel it's just a little bit discomforting. I'm not in a lot of pain. It's not causing, numbness or tingling down my legs. And I feel confident when I get off this. I'm actually gonna feel better. I'm not gonna feel worse, okay? But you definitely wanna get off in a nice, slow and controlled position. So bring the legs back up, lift the hips off, lower this down. And a lot of times I'll even just do a couple like windshield wipers side to side, just to kind of get things moving again. And then from there, you should be feeling better. Now, with all of these exercises, you want to hold those positions for 20 to 30 seconds at least. You can do it a couple times in a row until you really start feeling relief, and then do that even a couple times a day, all right? So it's really as much as needed. And again, if you're in severe pain after doing it, if it increases the numbness and tingling and it won't go away, you need to stop immediately, and you need to consult a specialist like a chiropractor, physical therapist. Those are the things that are going to help. You can honestly go to your general practitioner, you can get medication, you can get muscle relaxers. You might feel better temporarily, but that's not going to fix the problem. What you have going on is a mechanical issue, a structural issue that needs to be dealt with directly, okay? So hopefully that helps. If you like the information and you want to see more of my videos, make sure you like, subscribe, and even comment below. I'd love to give you more information.